Hi, everyone. Welcome to our Lunch and Learn. As we celebrate our diversity, equity, inclusion, and belonging, and as we transition from Mental Health Awareness Month to Pride Month, today we'll be discussing sexual orientation, gender identity, and mental health. I'm Nicole Diener, the Behavioral Health Lead here at Rubicon MD, and I want to introduce Dr. Ludwig Salamanca, our Medical Director of Collaborative Care, who will be our presenter on this topic. Dr. Salamanca will present some information out, and then we will leave plenty of time for questions and discussion at the end. You can also use the question feature to anonymously ask questions that will be addressed. We know that GoToWebinar is not the ideal collaborative tool. Having said that, we'll still hope to have plenty of interaction, and I will give more details about how to unmute at that time. Finally, we wanted to let you know that the presentation is in the handout section of GoToWebinar so that you can download it to find resources that we've included. Without further ado, I will turn over the presentation to Dr. Salamanca.
Yes, hi, good morning, and thank you all for joining us today. As Nicole mentioned, we're going to be talking about sexual orientation, gender identity, and mental health today. And just our reminder of our learning objectives for today's session. We hope that at the end of our time together, you will be able to understand the differences between sexual orientation, sexual identity, and gender expression, recognize the impact of stigma and discrimination on the mental health of the LGBTQ community, understand your unique healthcare needs if you're a member of the community, and know how to best be an ally. So just a reminder that this training is intended for informational and educational purposes only, and this does not represent any type of treatment recommendation. If you need any type of treatment recommendation or advice, please consult with your medical team. Okay, so let's start with a brief overview of sexual orientation and gender identity. And we're going to start with some common terms that we use. And here we have the differences between gender identity, gender expression, biological sex, and sexual orientation. So when we're talking about gender identity, we are talking about the way how you think about yourself, right? How you identify as either a woman or a man, or as a non-binary or non-conforming person. And here to the right of the slide, we see that a cisgender person will be someone that was born as a male and identifies as a male. A cisgender woman will be born as a woman and identify as a woman. A transgender person will be either born as a man or woman and will identify as the opposite gender. And a queer gender, non-binary, or non-conforming person will be either a man or a woman that do not identify with this binary way of thinking about ourselves, of either being man or a woman. In terms of gender expression, is how we demonstrate our gender. And this is based on the way we act, the way we dress, the way we behave, and we interact. And when we're thinking about gender expression, you're thinking more about your way of demonstrating your gender being more feminine or more masculine. When we talk about biological sex, we're talking about the sex that was objectively measured when we were born. So this is what will be in our birth certificate, either a male or a female. And sometimes some people are born intersex. That means that the objective organs that were observed at the moment of birth were not necessarily 100% clear if it was a man or woman. And then when we talk about sexual orientation, we are talking about who we are physically and emotionally attracted to. And here, when we talk about sexual orientation, a lesbian woman will be a woman that's attracted to women, a gay man will be a man that's attracted to men, a bisexual person will be either woman or man that's attracted to a woman or man, pansexual person will be someone who is attracted to women, men, trans people, or queer people. Asexual people generally don't have strong sexual preference. They just are not very attracted towards others. And a queer person can also be physically attracted to different groups of people in the community. Okay, so when we talk about pronouns, we have binary pronouns, that's he and she, but there are other non-binary pronouns like they and ze. And it's important for us to use the correct pronouns because that shows respect, validation, acceptance, and care. And people that identify as queer gender or non-binary find misgendering disrespectful and offensive. Something that we can do to facilitate the process is to start by introducing ourselves and then asking people how they'll prefer to be addressed. So here's an example. Hi, I'm Ludwig. My preferred pronouns are he, him, his. What's your name and preferred pronoun? And we're gonna watch a short video that's gonna expand a little bit more on this.
We asked some people in our community a simple question. What will you teach the world? Here's Tristan from the Pride Center of Edmonton.
I'd like to teach people about gender identity and how to use pronouns correctly. First off, let's talk about the difference between sex and gender identity. Sex is something that is assigned at birth. When the medical professional says, it's a boy or it's a girl, they are basing this off of your physical anatomy or your sex. Gender identity is a person's experience of their own gender. Most people's gender identity aligns with the sex they were assigned at birth. The term for this is cisgender, from the Latin cis, meaning on this side of. Someone who is transgender or gender non-binary, however, has a gender identity that does not align with the sex they were assigned at birth. Transgender and non-binary people can experience their gender in a variety of ways. Some transgender people may identify strongly with the gender. Some may feel disconnected from masculine and feminine genders, while others may experience their gender as a combination of both. Here's a quick refresher on grammar. Pronouns are words we use to refer to someone in place of a name. Some are tied to a specific gender, like he, him, his, and she, her, hers. Others, like they, them, theirs, are gender neutral. Some transgender people will use gendered pronouns as they affirm their gender identity. However, some transgender and gender non-binary folks will use gender-neutral pronouns. It's important to consider that the pronouns that feel comfortable for one person might not be for another. Okay, so why is this important? You probably have an expectation about what pronouns people refer to you by, and so do most transgender or gender non-binary people. Using someone's pronouns correctly is important because pronouns correspond with a person's gender. When pronouns are used incorrectly, we may risk misgendering them. Misgendering is when someone uses the wrong name or pronoun to describe someone else. This can cause distress for the person who is misgendered because they may feel that their gender identity is not validated and respected. Misgendering can also create a risk to someone's safety by outing that person to others. Unfortunately, some people purposely misgender others to insult them. Using the correct name and pronoun is about showing basic respect. If you're not sure, you can just ask. A great way to ask someone's pronoun when you first meet them is to say your name, state your pronouns, then ask the person you're meeting with what their name and pronouns are. Hi, my name is Tristan. I use he, him, his pronouns. What is your name and pronouns? Hi, my name is Jordan, and I use they, them, theirs pronouns. Thank you for asking. Once you know someone's pronouns, you will know how to refer to them when speaking to others. Hey everyone, this is Jordan. They're any friend of mine. We all make mistakes though. If you slip up, apologize and try to avoid being defensive. Hey everyone, this is Jordan. He's a new friend of mine. Oh, I mean, they're a new friend of mine. Sorry, Jordan. No worries, thanks. Getting someone's gender right is on you, not the transgender or non-binary person. Try not to make assumptions about someone's gender identity. You don't know someone's pronouns until they tell you. Pronouns are something important that most people don't think about. However, pronouns are extra important to many transgender and non-binary folks as it affirms their gender identity. Using someone's correct pronouns is important and validated. It's easy to get it right if you avoid making assumptions. In the end, this all comes down to treating each other with a little care and respect.
Great. So let's go back to our presentation. So some facts about the LGBTQ community. Very important things for us to remember. Parents cannot and did not make their children LGBT because of some type of parenting mistake. They did nothing wrong, and their children are doing nothing wrong, right? There is nothing wrong with being a member of the community. There are no known environmental factors that cause a person to be a member of the community. And people in the community just generally don't choose their sexual orientation or gender identity. They actually become aware of this at a very early age in their development. And the majority of people in the LGBTQ community go on to live successful, happy, and healthy lives, especially when they are embraced for who they are and who they love. Now we're going to talk a little bit about stigma, discrimination, and other related risk factors that the community faces. Here we have in this slide that more or less 4.5% of the US identify as members of the LGBT community. And of them, 1/3 experiences a mental illness. This is relevant because this represents 60% more than heterosexuals in our country. People in the community are 2 to 3 times more likely to have long-term psychological or emotional problems. They regularly face prejudice, harassment, and discrimination. And this results in serious issues for many members of the community. For example, transgender people attempt suicide 9 times more than the entire population. Members of the community are almost 60% more likely to develop an alcohol use disorder and almost 3 times more likely to develop another substance use disorder. And why is that the case? Here we have different numbers that try to explain the potential reasons behind this. 57% of the members of the community have been threatened or non-sexually harassed, with 51% being sexually harassed. 51% have experienced violence, with more than 50% that have faced denial of care, harsh language, or blame for illnesses. 40% have been rejected by family members or close friends, and 27% of transgender patients are refused healthcare. Here we have other potential reasons why members of the community are at higher risk. Here we have, for example, censorship of LGBTQ issues, and we know that recent states regulations banned LGBTQ topics from being discussed. Here we have how many states ban access to affirming care, and that actually goes against current medical best practices recommendations from many different medical organizations. While at the same time, many states do not ban interventions that mental health professional organizations consider not ethical and are actually advocating for them to be banned. It doesn't stop there. It impacts members of the community in many more basic rights and things that impact their lives even more significantly. Millions of LGBTQ Americans lack legal protection of many of their rights. Here we have, for example, that in 18 states, members of the community are subject to potential housing discrimination because there are no housing discrimination laws. In 28 states, there are no employment discrimination laws, and in 34 states, there are no credit discrimination laws. So they can be rejected to asking for a loan or a mortgage or even opening a bank account. All this have been only worsened by COVID. And the main reason why that's the case is because we know that compared with people who are heterosexual, people who are members of the community have higher rates of mental health conditions associated with serious COVID-19 illnesses. Another important thing that we definitely need to consider, especially practicing in our very diverse country, it's how there are cultural considerations that will impact different members of a community depending on their cultural background. So we know that people of the Latinx community, Asian Pacific Islanders, and African or Black Americans will have different influences in their life and will be impacted by how their own specific cultures of origin understand and interact with members of the LGBT community. And this is based on, once again, their cultures of origin, their cultural expectations, and religious values. So now let's talk a little bit more about LGBTQ affirmative healthcare. And it's important for us to keep in mind, if we are members of the community, we definitely need to understand our unique healthcare needs and also advocate for the services that we need. We're going to start by reviewing some myths about the LGBTQ population and the care they need. So the first myth is that the mental and medical needs of lesbian, gays, bisexual, transgender, and queer people are the same. And we know that that's not exactly the case. The care of members of the community needs to be individualized, but also needs to be informed by the knowledge of distinct risk factors and behaviors that are associated with particular groups. The number 2 myth is that sexual orientation equals sexual activity. For most people, sexual orientation correlates closely to their sexual behavior, but for many others, that's not the case. Individuals may engage in same-sex behavior, but will not identify as lesbian, gay, or bisexual. So we definitely need to understand that these two concepts are just two different concepts. And the same happens with gender expression and gender identity, because if we assume that gender expression and identity are the same, we can't be making incorrect assumptions. Some people will identify a certain way but express in a different way. And the fourth myth is that members of the LGBTQ community have the same access to healthcare as heterosexual people. And we know that that's not the case. That's why as healthcare systems, we definitely need to create welcoming environments that welcome everyone and specialize in providing services for individuals that have special needs. Here we have a summary of general healthcare needs for the members of the community. So all members of the community, it's important for us to keep in mind that the first need is just facilitating the process of coming out to their health providers, right? As I mentioned before, access is not equal, and members of the community are at a higher risk of STDs. It's also very important for all of us in healthcare to focus on safe sex with members of the community, also fitness, diet, exercise. As we mentioned before, there is a higher risk of alcohol and other substances to be problematic, so that's something that also needs to be addressed. There are higher rates of depression and anxiety and intimate partner violence among members of the community. So all those healthcare needs that we see to the left are common to all members of the community. However, to the right, we have some needs that are more specific to each one of those groups that we see. So for lesbian people, we have here that breast cancer, they have a higher risk of breast cancer compared to the rest of the community. Also, given the higher risk of obesity and smoking, they have also a higher percentage of cardiovascular health problems and GYN cancers. For gay and bisexual men, they have a higher rate of prostate, testicular, and colon cancer, also HPV infection and anal cancer. And for transgender members of the community, there are specific healthcare needs, since many of them will be on hormone replacement, will go through surgical reassignment and either masculinization or feminization procedures. They also have higher rates of certain types of cancer and cardiovascular problems. In terms of mental health, very important for us to remember that homosexuality was listed at some point as a mental health problem, but that has not been the case since 1973. And this is the American Psychiatric Association current position statement. The APA reaffirms its recommendation that ethical practitioners refrain from attempts to change individuals' sexual orientation. They recommend that ethical practitioners respect the identities for those with diverse gender expression, encourages psychotherapists which affirm individuals' sexual orientation and gender identity, and actually encourage legislations which will prohibit the practices of conversion therapy. So what is affirmative therapy? Affirmative therapy understands that a person's sexual orientation and gender identity cannot be changed, and that those are not the root cause of the problems, right? What it does instead is it respects all sexualities and genders and treats them in a positive way, providing an affirming space for clients in several different ways. And here we have some of the core tenets of affirmative therapy. It starts by acknowledging the challenges of the members of the community and helping their clients explore and talk about the different challenges they face, like discrimination, stigma, lack of support and representation. They also help patients identify and fight internalized homophobia and transphobia. It also helps patients not just judge or pathologize non-traditional identities, definitely helping clients be more comfortable with their identity and providing a safe and non-judgmental space. It also provides a lot of support and resources to patients of the community, and it can also help resolve contradictory beliefs and needs, especially for those members of the community that are coming from more conservative religious backgrounds or coming from cultures that have beliefs and traditions that go against the way of them manifesting their sexual identity and orientation. So how to be an ally? And here we have 10 different ways that we can all use to be better allies and friends. Number one, definitely be a listener and be willing to talk, be open-minded, be inclusive, and invite members of the LGBT community to spend time with you and your family. Don't assume that everyone you are interacting with are straight, because someone close to you could be looking for support in their coming out process, and if we are making assumptions, we can make it a little more difficult. Also, if you are identifying yourself making anti-LGBT comments or jokes, or anyone else making those comments or jokes, just be mindful of that and definitely try to either tell the person making the jokes or make yourself aware of this so this does not continue. Also confront your own prejudice and bias, defend your LGBT friends against discrimination, and really believe that all people, regardless of gender identity and sexual orientation, should be treated with dignity and respect. We're going to watch this short video that gets into that a little bit. So that's it. Love is what really matters. And just to be clear, we have no financial connections to this company, but we just wanted to show this video because it's nice to see how even in marketing and in broad media, these type of issues are being discussed and addressed. Okay, so here we have a different list of resources. Here are resources for healthcare for people of the community. Here we have some culturally supportive resources for Latinx members of our communities, Asian Pacific Islanders, and African Americans. And here we have some resources on how to best be an ally. So definitely invite you all to review these resources and share these resources with someone that you know could benefit from this additional information. Okay, so in summary, there are differences between gender identity, gender expression, biological sex, and sexual orientation, and there are binary and non-binary pronouns. There are no non-environmental factors that cause a person to be LGBTQ, and people in the community generally do not choose their sexual orientations or gender identity. There are 15 million people in the United States who are LGBTQ, and due to stigma and discrimination, they are 60% more likely than heterosexuals to have a mental illness. There are also health risk relatives to the LGBT population, and that's why there are best practices in mental health care and general health care for members of the LGBT community. And for mental health in particular, members of the community benefit from affirmative providers and affirmative psychotherapy. There are many resources to support members of the community and family members and friends. And some of them are culturally supportive and also resources that can help us all be better allies. And it's very important for us to keep in mind that we all have a role to play in supporting in our LGBTQ colleagues, family members, and friends, so we can all live happy and healthy lives. Okay, so do we have any questions?
Thanks so much, Dr. Salamanca. We do have a couple of questions. Actually, the first is just a comment from one of our listeners. This person said, just a quick comment, I'd like to add as a member of the LGBT plus community, the label of bisexual is not mutually exclusive of attraction to trans and non-binary people. In general terms, bisexual and pansexual are interchangeable terms and neither are exclusive of trans people. So just wanted to share that comment. Another question has to do with parenting. So if a person is a member of the LGBTQ plus population, how can they best support their children in growing up to understand how their parents are different and the same, as well as if you're a parent who may be heterosexual, how do you best support your children who come to you as a member of the LGBTQ plus population?
Great, thank you very much, Nicole. First, thank you for the comment clarifying the concepts, and second, and thank you for those additional questions. So going back to the first question, if you are a member of the LGBTQ plus community and you have children, I feel it's very important for our children to see our families interacting with other families that are heterosexual and also families that are members of the LGBTQ community, so they can see that their family is just as normal as all the other families and that we have broad base of friends and supports. And the other thing that's also very important to keep in mind is that many times you will be approached by other members of the community, right? Either members of the LGBTQ community or not, that will have questions about your family. And it's very important that when we are answering those questions, children will not identify any type of like hesitation or like change in your nonverbal or verbal expression, and that you are just answering and addressing this as something that's very normal. Kids are very perceptive to those type of nonverbal communications, and they are always paying attention of what we say. So when someone asks questions about your particular family, just be proud, be open, and just stick to the facts, right? So definitely don't allow for spaces where your children will feel that there's something wrong with their family or something that needs to be hidden, because that's not the case. So that's for the first question. And then the second question, as a parent, that it's identifying that his or her son or their son, it's potentially a member of the community. So definitely, as we mentioned before, how to best be an ally, be a listener, be willing to talk, and be very supportive, right? As we reviewed before, no one really chooses to be a member of the community, right? Being a member of the community is still associated with, as we reviewed, a lot of stigma, discrimination, and increased healthcare risks. No one will choose that, right? If they are identifying as members of the communities, because just that's who they are, and we need to really be supportive and validate those emotions and those ways of expressing than our children have.
Great, thank you so much. We also had a number of comments just thanking you for this wonderful presentation, so I just wanted to note that. The other question is from a physician, and it has to do, what are the best practices when we address more conservative voters that align with the Do Not Say Gay bill? How can we reframe their thinking to respect their conservative values while also protecting our LGBTQ+ population?
Yes, thank you so much. This is a very important question. And I feel it's key for us to keep in mind, as you're saying, right? How can we balance helping them be more open-minded and accepting, but also respecting their values? I feel that something that usually helps a lot is working with our patients when we think it's the right moment, right? And when we think we have strong and good enough treatment relationship with them, and when we think that this is one of the goals of our treatment interventions. When we are in that space, I think it's important for us to help them recognize in which aspects of their lives they are a minority and they are vulnerable because they are part of that minority, and then bringing them from that space when they are recognizing themselves as a minority and the implications of being a minority to the space where members of the LGBTQ community are a minority, and how both of them as minorities will have vulnerabilities and risk factors as a potential way of trying to increase their ability to understand the members of the community.
Thanks so much. That concludes the anonymous questions we had submitted. I just wanted to remind everyone that they can unmute and share a question if they'd like to at this time. So we'll just be quiet here for a couple of minutes and see if we have any other questions. Okay, it sounds like maybe we addressed our questions. I did want to remind everyone, as Dr. Salamanca mentioned, that in the handout section of the GoToWebinar, there is the presentation slides. So feel free to access the resources that we included in that presentation. I also wanted to thank you very much for presenting on this topic and in doing research for it. Although I considered myself an ally and a friend, it really benefited me to look at all of those resources that are included in the presentation, and I learned a lot. And I, as part of Rubicon MD and just as a person, will continue to do everything I can to be an ally to the LGBTQ plus population, all of my family, friends, loved ones, and colleagues. So I hope and join my other fellow colleagues to do the same. With that, I just wanted to thank you again, and I think we will go ahead and close the webinar unless there are any final questions. Thanks again, Dr. Salamanca.
Great. Thank you very much for joining us today.
Happy Pride, everyone.